Recording in progress.
Good afternoon. I want to welcome all of you to the Los Angeles County Board of County Commissioners acting in the capacity as the Board of Human Services. I want to call this meeting to order. Today is Tuesday, October 21st, 2025. It is 1 p.m. Please rise for the invocation by Commissioner Robert Lucero, followed by the pledge of allegiance by Commissioner Tony Harris.
Heavenly Father, as we gather in this meeting, we come humbly before you, asking for your wisdom and understanding to guide us. We seek that wisdom, Lord, trusting that you will grant us the insight we need to navigate the decisions ahead. Lead us today and always, that everything we do may bring glory to your name. In Jesus' name we pray. Amen.
Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioners. Roll call, Mr. Aragon.
Sir, Commissioner Lucero?
Here.
Commissioner Haas?
Here.
Commissioner Lopez?
I am here. Approval of the agenda. Do we have any changes to the agenda?
Not at this time, Commissioner.
Thank you, sir. I will entertain a motion to approve the agenda.
I will move to approve the agenda.
Second the motion.
Commissioner Lucero?
Yes.
Commissioner Haas?
Yes.
Commissioner Lopez?
Yes, thank you. Section 2, we have September 16th, 2025, the regular meeting minutes. Any questions, commissioners, additions, deletions? Here or not, I will entertain a motion.
Move to approve the September 16, 2025 regular meeting minutes.
I'll second it.
Commissioner Haas?
Yes.
Commissioner Lucero?
Yes.
Commissioner Lopez?
Yes. Thank you, and at this time, anyone that wishes to address this board, the San Luis County Board of County Commissioners, acting in the capacity as the Board of Human Services, 3 minutes. Anyone online or present? Seeing none, we're going to vote now. No items on, Director's reports, Mr. Aragon. And by the way, good afternoon, sir. Thank you.
Good afternoon, Commissioners. Thank you. So just a couple of things. I'm going to obviously discuss a little bit more about the SNAP concerns that we've been hearing about, but one of the things that I wanted to inform the board on that's been, or we're in the process of, is there is a Resilient Colorado grant that we're going to be seeking. I'm looking to hopefully reach out to some of our community partners in order to go after this. And the Resilient Grant is the priorities of this funding is youth well-being and prevention, treatment and recovery for youth, especially in rural and underserved behavioral health areas, including recovery and re-entry for justice-involved youth, and supporting family and caregivers in that process. And so I'll be reaching out to some of the partners that we met with and partnered with at our opioid summit back in May, as well as some additional partners that I'm hoping to bring on board with that. And I did meet with the state this morning to discuss that. Our deadline for that grant is December 18th, so it's a tight turnaround, so we're going to try and get that completed as quickly as possible, and I'll keep the board updated on that.
What is the amount that you're receiving?
Right now, we haven't put a dollar amount to that quite yet because we want to identify a little more concretely what the programmatic piece of it's going to look like and what that cost analysis needs to be done. We have not done that yet. So this was just brought to our attention within the last couple of days, and I think it's a great opportunity that we can look at that, especially one of the big pieces is we have our upcoming first Fossil Region 1 council meeting. The committee has been formed. I am representing a portion of the rural area for Region 1 on that, and I understand you are as well.
Yes, sir.
And so one of the biggest pieces that we have struggled with in the past is having support from the state level on behavioral health in the rural areas. And so we're hoping that through this grant opportunity and working in partnership with the VASO and RA, we might be able to increase access to services here locally.
So this Resilient Colorado grant who is putting the application out?
So this is both with the Colorado Opioid Council along with, I should have brought my glasses, my apologies. And it's also issued through the Attorney General, so I assume it's similar to what we've done in the past. However, the grant opportunities, there's up to $12 million in funding to obtain, so we're hoping that we can secure quite a bit. And we're looking at a couple of different behavioral health models in the rural areas surrounding us that have been successful to identify that. And really want to work with our local health department and Ms. Gonzalez over there, because I think she really has a grasp of what the needs are. And so I'll be reaching out to her in the next couple of days to try and engage with her and see where we can move forward.
Well, congratulations, that's, and as well, we have the opioid Region 19, that may be another opportunity once if, or in combination of both.
Yeah, I think in that regard, one of the main things that we discussed with the state this morning was specifically around keeping the conversation kind of going regarding the summit that we held in May. Is there still need for that type of communication within the community and within the region? And I agree there is. I think there's a continued need to have that discussion. And so we would be looking at that again to host some kind of community forum like we did in May in the next year. But one of the main things is that having that discussion, but having the support services to support and meet the needs of the growing end. And I will say there has been several instances that have come to my attention through our department in the last couple of weeks of youth and substance abuse issues, and it's become extremely detrimental to our community. It's not something that I'm willing to let go of easily, because we need to get in front of it. And so I'm hoping we can. I'm hoping we can secure some of these funds and we can begin working on a program to really work within the school systems and with our youth in engaging them a little deeper. I'm also looking to our law enforcement to step in as partners on this. So I reached out to the city manager as well, and I'm hoping to hear back from them as well.
Good, so since this is going to be several partners, sounds like it could be a CDBG type structure, right? Okay, keep us posted.
Will do.
Really appreciate that.
And then the other big piece, of course, I'm here to update. I know there's been several communications and meetings held in the last few days, last week, but we are facing a significant crisis with SNAP benefits. It's not a county specific, it is a countrywide issue at this point. Because of the federal government shutdown, the state of Colorado was informed by the federal Supplemental Nutrition Services Program, FNS, that we are to hold all SNAP benefits for the month of November statewide. In numbers, what that equates to is about 614,000 plus Coloradans going without food benefits as of November 1. About 50% of those youth are children, 10% are elderly, and 15% are individuals with disabilities. In our county, that equates to about 3,042 individuals, with about 50% of those being youth or children. So over 1,000 kids who will not have access to food, depending on where their families are at financially. It is a major crisis, and we have not seen or heard any movement in a resolution at the federal level to reopen the government anytime soon. So we are very concerned as to what this is going to look like for our county.
Well, thank you for the advocacy. Submitted a letter or a message online to one of our senators, and then of course we had the CCI conversation. And I had a conversation back with the executive director, CCI's executive director, to work with the executive board and see if we can submit a letter to the federal delegation. And so I would hope that that is going to happen. And also hoping that every state association does the same thing about the senators.
One of the main things is as we move within this week and next, food insecurity is already a challenge within our county and our community. The secondary and tertiary effects of this are not even grasped. I don't know if folks truly understand that when we're not putting those SNAP benefits into play It also impacts some of our major vendors here in the county, including Walmart and Safeway and grocery stores and those folks. That hits their bottom line as well. Economically, this is going to have a major impact. We do about $547,000 a month in food benefits. I know that a former Safeway employee had indicated in the last government shutdown where SNAP benefits were questioned, they had lost about $100,000 in a week in revenue. That's a significant loss for our vendors. And so it will have secondary and effects upon our county, not just for those not receiving SNAP benefits, but those that work in those vendors. We don't know how long this shutdown will last. We do, however, want to put out that the department is still processing applications and recertifications on time. There is no delay in that. We're hoping that when the federal government reopens, that those will kick in and those benefits will roll in. As of right now, vendors are still capable of accepting EBT throughout the U.S. There's been no directive to close down accepting EBT, so we encourage our vendors that are out there to continue because any balances that are currently on folks' EBT cards are still usable at this point up until the 31st of October. So we're encouraging folks to get the supplies that they need now. But as of November 1, if we're still not open, then we've already started to see letters generated in our CBMS system indicating that there's a withholding of the November benefits. So we know that there's an amount, but we know that the system's already flagged to withhold.
If some of these people are holding EBT's money and trying to hold them into the November, will they be able to use that in November if there's still money on the October that they received in October?
So we're encouraging folks to use any balances that they have prior to October 31 because when the November 1 hits, we don't know and we can't guarantee, the state is not guaranteed that those benefits would still be available at that time. So we're really encouraging folks to use whatever balances they have now because there may be no available balances as of November 1. One of the main things I've been doing the last few days is working with other community agencies to determine how we can get in front of food insecurities for our families here locally, should that need arise. I've spoken with several agencies around the county. The department's also always has an inventory of food resources for folks, so we will continue to gather information as we can and try to provide guidance on that as clients come in.
I know the meeting we had last week with CCI, there was going to be another one, I would imagine, next week. Just put another update, but nonetheless, I mean, this is on the hands of Congress.
Yeah, and as I heard this morning, as we know, they were out for the weekend. They came back, reconvened yesterday. A new proposal was put forth, but they do not anticipate that it will be passed. They do anticipate it will be rejected again. So we're still at an impasse with coming to an agreement at the federal level.
It got through the House, correct, but it needs to head through the Senate.
It does, and they're not hopeful that the Senate will pass. They feel that the Senate will reject it. So that was as of this morning, based on what I was listening into on those discussions.
So, you know, one point of clarification, the clean resolution, continued resolution that is in front of the Senate right now is the one that was approved in a few months back. Exactly the same thing. There was no added on or deductions from that particular continued resolution. So when you go online and take a look at that, and it was approved back then bipartisan. They have bipartisan votes, and they were able to pass it both through the House and the Senate. And so right now, that is the hopes that, because it was reported before, that they would have the votes to pass it once again, because the House already supported it. And going to the Senate, it would be a yes vote. However, some of the demands that, and we don't want to get into the weeds with that, but you can go online to the to read that clean resolution bill, is the continued resolution, and it's those add-on demands that are in there that are holding you back. You know, one of the comments that I made at CCI, and I think I also sent that to our U.S. Senator, is pass it as it stands, feed Coloradans, feed Americans, and then go back and work on. You have about 90 days to go back and work on the proposed 2026 federal budget. They still have enough time to go back and identify what needs to be funded and what not. But at this point in time, I think it's, as you said, Mr. Aragon, it's an impasse. And so keep us posted, and thank you for that update.
Will do, Commissioner. One thing I do want to add, though, for the community members to realize is that although we're talking about SNAP benefits, Medicaid services are not impacted by the federal government shutdown. We encourage folks to continue to apply if they're in need of Medicaid services. That is still in full swing, and that is not affected. Other programming may or may not be affected, but we've not received any notice of that, any of the federally funded programs. At this point, everything else is operational. Really, the crisis on our hands right now is SNAP benefits. And that's all I have for a director's report this month, Commissioners.
Well, thank you.
Real similar to the one that I gave this morning.
Yes.
Our numbers jive, so we did well.
Any other conversation, any other questions for Director Aragon? We go now to, there are no items on section 5, so I'm going to go to section 6, and it is the 6A, consideration of case law counseling activity of the program, June and July. Back to you, Mr. Aragon.
Commissioners, and I apologize, I didn't realize that's the June and July at the end there, but it's actually for ours, August and September numbers, just so that you're aware. The case counts are in front of you. I do have, oh, you snuck in, didn't you? Ms. Sarah and Ms. Ringo here, if they had any information they wanted to share with the board today.
So, Commissioners, I just wanted to share with you, unfortunately I missed this meeting yesterday, but there was an executive meeting hosted by Healthcare Policy and Financing, and they're reminding all the case management staff across the state that the state of Colorado is experiencing significant challenges. The state is waiting for the budget of the governor to be rolled out on October 31st. They're putting together a communication team to answer any questions that members who receive services or their families can ask. They're also indicating that due to the budget shortfall, there's a $1 billion shortfall. They've made up 79 point something million. But they're asking for budget reduction ideas across the state that makes sense. They're trying to do it in a way that at least affects members. So I feel like it's coming. I always thought CMA, Healthcare Policy and Financing, we were going to miss the impact of this. I know we suffered the 1.6% reduction, but it looks like it may be more than that. So I feel like they're preparing us. And Kim Beinstetter, who is the overseer, the director of Colorado Medicaid, presented at this meeting. So I feel like something serious is coming as a result of that. As a result of the SNAP decrease, I mentioned to Michael, under Case Management Agency, one of our services, and it just started 2 years ago, and it originally started to help people who were discharged from hospitals, knowing that they needed proper nutrition to get better quicker and to not be so heavily reliant on services. But they started home-delivered meals. And I believe there's 5 companies through Colorado. We've had Tina Gonzalez, who was our former Ray representative, go to work for another company called Moms and Meals. And with this program, if they are on an HCBS waiver And right now, we know for sure they're on the CFC program, which we started phasing clients over to that at their reading terms effective July 1st. We can offer to clients this service, which means they could receive up to 14 meals a week to help offset this. And what they do is there's these companies and they FedEx the meals to you. You look at a menu, you pick what you want, you can choose from breakfast, you can choose lunches, you can choose a dinner menu. Like there was breakfast sandwiches, there was Salisbury steak, there was Hawaiian chicken, just a variety of things. And it comes with snacks, healthy snacks go with it all. So we were thinking that maybe that's something we could do to start really offering to our clients, especially our CFC clients. And I'm double checking because I think we can offer it to clients that are not on the CFC program yet. But I've got a message or an email into the state and asking if we could bypass some of the bureaucracy, some of the paperwork that we need to do and just offer this to clients because it takes 2 weeks to set it up. And I figure if we can help our elderly and our seniors, then we can, and disabled, and I know many of our seniors only receive $10 in food stamps a month, but they're suffering the impact of the high cost of groceries. Maybe we can put money towards the families. So, you know what's that.
So Lori, the 5 companies that you mentioned that are working throughout Colorado to provide these services, do they reach the entire, all the outlying areas of the state?
Yes, yes. Anywhere where a client lives and they can get something FedEx to them. It's FedEx in a styrofoam cooler with ice, and they make sure that the client knows it's on their porch.
So they send them for the week?
Yes.
And the eligibility requirements, you would be vetting those clients, making the reference to these programs?
Yes.
Okay.
Yes.
So there'd be 14 meals in one box, 14 meals a week?
Yeah, I know it's 14 meals a week. I don't know how they send 14 meals. But that's what they're doing. And
How are those programs funded?
it's through healthcare policy and financing through Medicaid. It's a service
Okay.
through the case management agencies. So they have to be, right now on the CFC waiver, they're a new client. And then I believe because at first they only opened it up to clients who got out of a hospital. You had to have be within a 30-day discharge from a hospital. And then there was like a nutritionist had to be involved. It was very complicated, but I believe they opened it up last year to all HCBS clients. And if that's the case, which I think it is, we can offer it to all our clients. So our case load, we can offer it to those clients. Right now, we know we can offer it to probably 1/4 of the clients that are on CFC, as we do their review terms.
In a fourth means how many, roughly?
About 120. That's between both Huerfano and Los Animas County. Just keep in mind, there's about 470 to 480 clients between the 2 counties. About 370 of them are here locally in Los Animas.
Thank you for recognizing that alternative means. That's huge.
Yes, because I figure, and they're healthy and they look good, and there's different companies. The only thing is it takes us 2 to 3 weeks to set it up. But the sooner we can start moving on this, the sooner we can help our elderly and disabled.
Well, I think the eligibility is there for Los Animas County to be a participant. And you have some clients that are ready to go. Let's do
Yeah.
it.
Yeah, because I was asking Michael, can we break the rules and do what we have to do to help the residents? Yeah, so that's.
Maybe not that far.
Same answer.
Yes. Thank you.
Thank you.
Put the volume down. Yeah, 3 months.
Chrissy, did you have anything you wanted to update the board on?
I can go your time.
Yes.
Sure.
That's not Miss Mason online. And I'll have to apologize for, we were supposed to have a presentation of a document, but we'll do that in the November meeting for you all.
Christy, you can twist that. I mean,
Oh.
facing There you go.
You're gonna make me do this?
I'll do it for you.
I got it.
Okay,
I just don't want you to feel awkward there.
well, thank you.
So we're gonna have you stuff the podium over and that.
Yeah. Well, hello. I wanted to update, our C-stats are changing a little bit for child support. So the Colorado statistics, each unit in DHS has different C-stats. For one, we're still gonna have timeliness of case initiation. So getting that application for a new case and putting it up into our system. It's still, they want us to get it done within the 20 days. But instead of 90% of cases as of October 1st, it'll be 92% of cases. We're gonna be a little bit below that for a while. There were some training opportunities the beginning of this year. So just a warning, we're a little below the 90% right now too.
So let me ask you that 2% in numbers, real numbers, how many more cases does that bring to your case count? I mean, 2% sounds like small stuff. I mean,
Right, but like we have, I don't know,
Yes.
sometimes one case put up a month. So if we miss that one case, then we're at 0. Sometimes
Okay.
there's 5 cases, you know, so ultimately I think it's very doable. We just had a lot of training opportunities the beginning of this year to work through. So I think now, August through September 2020, hold on. The last few months, we've been May through August, I think. We were at 100%.
Yes.
Yeah. So we've been doing okay the last few months. So I think it's very doable. It's just going to be a little bit below the line there for a little bit for the year average. Then they took away our disbursements on hold CSTAT. So as of October, so we will no longer have that. Disbursements on hold was, we have a payment received from the paying party, we're dispersing it to the receiving party, and they wanted us to have less than 4.2% of those disbursements on hold. So the state as a whole has been doing really well with that, and us included, where we needed to be less than 4.2%, and so they took that away for now. So that will not be showing up moving forward. Then the review, oh sorry, this is my echo. The timeliness of review and adjustment administrative process action. That's when we get certified to perform modifications on court orders. It was where we needed to, within 6 months, put up the new modified order with I guess that one's staying the same, so within the 95% of the time. And right now we are meeting that goal. So we also have the timeliness of review and adjustment for judicial actions. It's also with the putting up the new modified order within 6 months, 90% of the time. So we have a little bit more leeway there. That's remaining the same. And then they're adding a new one. So starting November 1st, we're going to have a CSTAT for establishing child support orders. So starting October 1st, they're going to be monitoring this goal, and November 1st, you're going to start seeing the goal. To be quite frank, it's going to suck. It's going to be bad. So, let me read what I put here. So the goal is to establish a court order with putting it into our system within a year from the date of application. That doesn't sound too bad. However, this is a brand new CSTAT in which there have been no testing of this measure until now. There are also no specifics regarding the CSTAT. Two big time spenders when another state is involved. When we don't have jurisdiction, it takes a long time for that other state to move along, and also trying to find the respondent. So this is not a year from locating the other party to get them served, to get a hearing and get an order. This is just from the date we get the case to putting out the order. So thankfully that doesn't affect any of our federal incentives, but it's not going to look good while they're...
So all in all, you talked about the previous point that you made on disbursements on hold. What is the amount that would be forfeited, if any, when it comes to not receiving all the disbursements? I think I understand that properly.
When we're, so for disbursement on hold, us sending the money to the party.
Correct.
And what was your question?
No, basically, what is the total amount that usually, when you're sending that money to that party, what is the amount that the county, in general, roughly works with?
That's a really difficult question to answer because it varies so much month to month.
Okay.
One of the best ways to kind of look at what that dollar amount is in the share report that we provide to you on the financials.
Okay.
In the child support section, there's a space called over-the-counter payments. So those are where we've taken in the payment, we've held that payment, we disperse it out to that individual, whether it's through the family support registry or if it's in arrears or whatever that looks like. So that dollar amount can fluctuate. I will say that it usually fluctuates between, on the low end, I've seen around $8,000 a month. On the high end, I've seen around $12,000, $13,000. So that's roughly what we work within each month. On average, we go in, and I know Deputy Director Eklund's got some follow-up to that.
So it doesn't affect just over-the-counter?
Correct.
It's the, whatever we collect within that month. And I always say we, because I was an underground, I can't, I'm not anymore. But, so what happens is whenever we collect a payment, we have to make sure that that payment gets to wherever it belongs.
Right.
So if that payment belongs to the non-custodial party because they have overpaid, we have to make sure that we get that money back to that non-custodial party. So there's really no dollar amount.
Yeah, that's hard.
It's just basically...
It's rather the process is so convoluted.
Right,
Okay.
right. So, I mean, it can be owed to anybody, to the non-custodial, the custodial. It could be owed to even, we could be sending it like an IRS intercept.
Yeah.
Intercepted it in error. We have to get it back to the person that it belongs to. And so we just have a certain amount of time to get those out. And for this particular CSTAT, what was happening is there were a lot of payments on hold that weren't getting out, and so they made it a CSTAT so we can improve on it. And basically we met that, and so they're taking it over.
Okay, very good.
Yeah, they changed it where the custodial parents, they don't get checks anymore, and so that decreased it a lot. So they had to get a payment card or direct deposit to get those funds moving forward. And so that took away a lot of our disbursements on hold because we weren't having to try to get them to cash checks or make sure they got to them in the mail. But now we have another report to work of people not using their cards, but that's something else. So,
Okay.
yeah.
So, clarify a little bit more for me. I'm still establishing the child support orders, and you're going to be working with schools. Is that what you?
No.
Okay.
No, it's just, so they're saying from when somebody applies for child support, either it's from like a TANF referral or they give us a paper app or however, to getting that child support order into our system and start collecting money to get to the custodial parent.
How is the system to work with out of state? You know, I mean, you can have the responsible party for child support living out of state, and now you're talking two different jurisdictions, and I saw you look at council, and I know those things are complex, and not that we want to know all of it, but that sounds like a tremendous amount of work.
Yeah.
It is. And realization that it's not child support alone. We have child protective services and adult protective services where we have to work through interstate or interstate governmental agreements. So we might have youth that are removed from the home and they're placed in Tennessee, I think is the furthest one we've had since I've been here in 6 years. And oftentimes we're either working with an agency out there, a human service agency or social service agency to perform courtesies. And kind of the same with this is there's a lot of back and forth with other states. And I will say those are the cases that tend to be the most delayed in many cases because it's very difficult to get other states and agencies to respond timely. And so those are very difficult cases to manage no matter what division you're in that it occurs.
Thank you.
I'll just point out, Commissioners, that change to CSTAT was something that we discussed several months back after we received our distinguished performance, that CDHS and folks deemed that maybe the scoring was a little low for targeting. And so they've been modifying and changing those CSTATs across all programs. Some will see that, some will not, but I anticipate we're due for some more changes from that.
Well, you are trailblazing through and making us inroads with the state, so thank you, and thank you for the work that you do.
And then, Ms. Mason, I know we were supposed to have you present Marcy. If you have nothing to add, do you want to just wait till November's meeting for the family support plan? We cannot hear you, Marcy. Speaker. We can barely hear you. I don't know if it's our speaker. Let me see if I can.
Can you hear me?
A little bit better now.
Very low, but yes.
I'll try to speak up a little more.
There goes.
I have an annual family support plan. It's a deliverable that's due to the state by October the 1st, and part of filing that plan is we indicated that we would review that with our board members. So it's just an annual review of what our goals, plans for the coming year, how we spend funds, which are state general funds, in the past year, and also it's combined with a family satisfaction survey. So we have that. We'll do a copy of the report, and it has been presented to Health Care Policy and Financing for their review. So I'll get that to you.
And again, Ms. Mason was on time. This is on me. We did not put it on the agenda for today, but we do have some leeway there, so we will get it in front of the board in November so that we can get that approved. And they spent, I will say, an exorbitant amount of time conducting those survey outreaches to the families under FSSP. Her and the case manager, Joey Gonzalez, and Ms. Mason and them have put together a really well thought out report on the results of how we've utilized that state general fund programming funding with the families here locally. And we again serve both Huerfano and Los Angeles County with that program. So it's a dual county perspective that they're working. Thank you, ma'am. Other than that, Commissioners, I have the case count for you in front of you. If there's any questions, I can answer those.
Any questions, Commissioners? So at this time, I think we would probably be okay to do, make a motion item 6A from I to 5.
I'm going to move to approve the caseload counts and activity by program for August and September.
Second motion.
Commissioner Lucero?
Yes.
Commissioner Haas?
Yes.
Commissioner Lopez?
Yes, thank you. And I know we have a couple of reading documents here. Thank you, have a great afternoon. Consideration of MOU agreement for the County DHS, CMA federal subrecipient, Mr. Eric.
Commissioners, every year we are required, as I've mentioned, Huerfano County DHS is a subrecipient, and they perform case management duties for the HCBS waivers specifically. Ms. Mason's team covers both counties for the HCBS IDD waiver services along with state general fund programming. In front of you is an MOU agreement. This is backdated to July 1. We were waiting on the state to give us some updates on some contractual items, and that's why this is coming to you now, so that we can then go ahead and release funds for the subrecipient work that they've done.
We have an MOU between the San Luis County and Broward County.
You do?
Am I looking at the wrong?
I think so. I took.
Very good.
I was like, well, I missed that one.
Going back and forth. All right.
And yes, legal has had an opportunity to review.
Yeah, that was a big miss.
I was waiting for it.
I have reviewed, I have no legal concerns.
Thank you, council. It is Tuesday afternoon. Commissioners, any questions on this particular agreement? Hearing none, I will entertain a motion.
Move to approve the MOU agreement between Huerfano County DHS, CMA federal subrecipient.
Second?
Commissioner Hess?
Yes.
Commissioner Lucero?
Yes.
Commissioner Lopez?
Yes, thank you. 6C, consideration of this agreement for Woodland 2025-2026. Back to you, Mr. Aragon.
Commissioners, we have had a lease agreement with Port Wooten for the last 2 years. In front of you is a proposal to maintain that lease agreement. We are utilizing 4 office spaces over there for storage of files, as well as our family support programming, lending library. We just don't have the space within our building to maintain that. So we'd like to maintain those that lease agreement. I was able, thanks to Commissioner Haas, get in touch with Fort Wooten this afternoon prior to this, and so everything that is on this lease agreement is to date incorrect, including cost.
Be interested to find out who the new landlord's going to be.
Yes.
So the, as you look at this $1,250 per month, that has been budgeted.
Yes.
And the council has read this. Absolutely.
No legal concerns.
Thank you, madam. We appreciate that. Commissioners, any additional conversation on this? Then I will entertain a motion.
I'll move to approve the lease agreement for Wooten from 2025 to 2026.
Second motion.
Commissioner Lucero?
Yes.
Commissioner Haas?
Yes.
Commissioner Lopez?
Yes. 90, consideration of assignments work from the county's district health department mental health services MOU. Back to you, Mr. Clerk.
Commissioners, as you know, Charlotte Chenoweth Swift, our internal mental health provider for the department, retired as of August 31st, and we wish her well in her retirement. But in that left us a bit of a gap with mental health services. We are well aware of the health department's program regarding mental health services being provided under their grant. And so I did want to find a stopgap for that break in services to our clients. And so we have been working with them to develop an agreement between us and the health department and the excuse me, and the agency to bring forward opportunities to provide them with mental health services at the health department locally. That agreement is in front of you here today.
Thank you, and council, you've had an opportunity to review that.
I have had no legal concerns.
Thank you. So, Mr. Aragon, at the $100 per voucher, that's going to be redeemed, that's basically per visit.
It is, but keep in mind that this is, that we will enter them as a core provider. Under core mental health services, that's 100% paid by the state and the Fed. So that's a Medicaid-based service. So those individual reimbursements will be paid to the agency providing those mental health services through the health department directly under that provision.
Okay.
So it would be very rare that we would be paying them directly out of, say, block or other programming.
Okay.
And the first, correct me if I'm wrong, I'm trying to remember everything I heard at the health board meeting, and the first 10 are free through Los Angeles County Health.
If they
Yeah.
qualify.
If they qualify. And then if they need additional services, they can get up to 10 more through DHS.
Well, with core mental health, there's no capacity.
Okay.
There's no capacity. So if they qualify under the mental health at the health department up front, they will be given those 10. And there's different, I've talked to Ms. Gonzalez about this, there's several different programs that they can qualify under that funds those 10 sessions. If it goes beyond that and the core then kicks in, there is no capacity on that end because as long as they're within the child welfare system, we continue to provide those level of services. The one thing about this is that they bring to the table both substance use concern therapy as well as domestic violence, which are two of the main areas that we have struggled to find mental health services in. They also provide bilingual services. They have a full Spanish-speaking provider. So it gives us access to more mental health services than we've had traditionally in the past, and we're grateful for that. And yeah, so I feel like this stopgap is one of the best ways until we can also, and the plan is still to bring another mental health provider on board at the department at some point, but it probably won't be anytime soon. Because we have this ability to utilize these services now, and we're still in holding. We do have a potential mental health provider, but we're probably going to be about a year out on putting that person into place full-time. So we'll probably look at it as more of a part-time position as we move forward.
So if or when you're successful in receiving a Colorado grant, could this be part of? In addition to, or are you going to be operating that pretty much on a different perspective?
Yeah, it'll be operated on a different perspective. What my hope is that outside of this agreement with our child welfare planning or programming, is that the grant seeks to create programming locally that brings in those mental health providers, but on a different dynamic and a different subject area and platform. So it'll look a little bit different from these types of direct services.
So let me ask one question. The last question I have is there any dollar amount attached to this agreement with the San Luis County Public Health?
No.
Okay.
No.
And just for your information, I've been talking with Sally Clark, who was reappointed as the USDA Secretary. And we're trying to get those funds for the MAT van reinstalled, so initiated, and we'll see what happens. But she seems to, after this government shutdown, she seems pretty positive about it. So
Excellent.
In fact, that she has offered to come and do a presentation in the San Luis County. Very good. Any other conversation on this item? Hearing none, I'll entertain a motion.
we need to approve the LCDHS Los Angeles Worthville County District Health Department Mental Health Services MOU.
I'll second that.
Commissioner Hess.
Yes.
Commissioner Lucero.
Yes.
Commissioner Lopez.
Yes. 9A, consideration of contractual agreement, Bethel and Santola Group, LLP, Employment Legal Counsel. Well, we need a legal counsel to review this agreement.
And I did not have concerns until right this second, and it's an easy fix. On the first page where it says fees and expenses, it does state that the anticipated fee will not exceed $5,000, which is fine. The last sentence says that there will be written confirmation if it intends to go over the 1,500. So we just need to correct that last number from 1,500 to 5,000.
5,000, okay.
But with that change, I have no other concerns.
Okay. Commissioners, any other questions? Any discussion? I will entertain a motion.
I'll move to approve the contractual agreement, Betchel and Santo Law Group,
With that
correction and appoint legal counsel with a correction be made on, from $1,500 to $5,000.
Second motion.
Commissioner Lucero?
Yes.
Commissioner Hess?
Yes.
Commissioner Lopez?
Yes. Financial matters. Consideration of our financials and bills for August 2025. Finance Director, welcome. Good afternoon. How are you?
I'm good, thank you. In front of you, there are the two financial reports, the treasurer's reconciliation and statement of expenditures, revenues, and county shares. Is there any questions in these reports?
No, you seem to be doing really well on the financial side of the house.
Thank you.
Congratulations.
Okay. So for our expenditures for the month of August, we have $42,321.01.
Down to the last penny.
Down to the last penny. Okay, do you have any questions regarding the expenditures?
No questions.
For the payroll, September 15th, 2025, $123,396.57. For September 30th, 2025, the total payroll, $121,513.01, which includes the 1099 of $6,990.53. Any questions on payrolls?
No questions from me. I just really appreciate you putting the summary on one page, so thank you for that. Commissioners, any other questions? Hearing none, I'll entertain a motion.
Commissioners, before you do that, are you planning to consent that or?
No, we're going to go,
Okay.
yes.
Please.
For 7A, I move to approve the financial bills for August 2025.
Second.
Commissioner Hess?
Yes.
Commissioner Lucero?
Yes.
Commissioner Lopez?
Yes. 7B, consideration of payroll for pay dates September 15th and 30th, 2025. Back to you, ma'am.
Okay, September 15th, 2025, $123,396.57. For September 30th, 2025, the total amount is $121,513.01, which includes the $6,990.53 for the 1099.
As Commissioner Tony has, that penny, just down to the penny. Commissioners, any questions? Hearing none, I will entertain a motion.
I'll move to approve payroll for pay dates September 15th and 30th of 2025.
Second motion.
Commissioner Lucero?
Yes.
Commissioner Hess?
Yes.
Commissioner Lopez?
Yes. And having no other items on this particular, unless otherwise noted, I don't have any other items on this particular agenda. I will entertain a motion to adjourn this regular Board of County Commissioners acting in the capacity as the Board of Human Services.
So moved.
Second.
Commissioner Hess?
Yes.
Commissioner Lucero?
Yes.
Commissioner Lopez?
Yes, thank you. And you all have a great afternoon.